Let's talk acoustic neuroma. What is it? Where is it? What does it look like? And all the things. So an acoustic neuroma or vestibular schwannoma, okay, it's the same thing, two different names. What it is a nerve cell tumor that is benign and grows very slow on a very specific spot in your body. Sorry, I'm momming as always. I'm going to try to put up a picture to show you guys and kind of illustrate what I'm talking about. So you have your external ear right here, okay? Then you have your eardrum, and on the other side of that eardrum is when people say like they have an ear infection that fills with fluid. That fluid gets infected, especially in younger kids. Now, even deeper than that, you have your cochlea and your semicircular canals. Your cochlea is what's responsible for your hearing. The semicircular canals is what can control your balance and your equilibrium. Also, when I tell people I have vertigo issues, most people are like, do the Epley maneuver, do the Epley maneuver. If I had stones that were in the semicircular canals, that can cause people to be dizzy. And yes, the Epley maneuver would be great for that. But unfortunately, that's not my issue. My issue is actually deeper than that. So if you keep going, you will actually follow that little nerve track that goes deeper into the skull to the brain side of your ear. So basically, it is where the brain, you have your brain stem, and then you have a nerve that comes off of that brain stem and goes through the backside of your ear and feeds three things: your hearing, your balance, and your face. So those are the symptoms that I have had. My hearing is almost gone. My balance is off and I have vertigo episodes. And then 3, I've noticed some like little facial twitchings and stuff like that occasionally. So I actually have a tumor, a nerve cell tumor on the brain side of the ear, okay? It's very slow growing. I've probably had it for years. I actually had an MRI done 5 years ago when I first had this done. It was probably very, very small then. It's still very, very small now, but they can definitely see it, and it's kind of a progressive thing. That you've got several different options of treatment. You can like watch it and see what happens. You can choose radiation, or you can do surgical removal. I haven't done, right now I'm just kind of waiting and watching while I'm just kind of putting my ducks in a row of exactly what I want to do. Because to remove this thing is a really big deal. It's a craniotomy and recovery and trying to kind of relearn your balance, your equilibrium, your hearing, or if anything's left of it, if you choose to put a cochlear implant or not. So just a lot of what ifs. But sometimes I feel like knowledge is a source of treatment. So understanding what is going on with my body and why it's changing in this way and showing with diagrams exactly what's going on really helps me. So I know I've gotten a lot of comments about different types of brain cancers, and my dad had brain cancer, so that's always a thought. But this is very characteristic of what it is without getting a biopsy of it. But of course would make me lean more towards getting it removed because it's not supposed to be there to begin with. But just the process of getting through that. Anyway, I just thought that we should have an anatomy time and you guys could learn more about my tumor.